Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras A Changing America. I'm Anthony Moreno. On this episode, we turn our focus to mental health. We'll hear from a retired clinical psychologist on mental health issues who now hosts a radio program in Las Cruces. Also, we'll learn about how one organization in our region works to ease the stress cancer patients may face while promoting health and wellness. We start off this program by bringing you the story of an El Paso artist and muralist, Tino Ortega, who says he found healing through his art. His popular murals aim to help others in the city by honoring those who lost their lives in the August 3rd mass shooting in 2019. His work also aims to provide inspiration and pride in the community. This year, Tino Ortega traveled to Uvalde, Texas, and painted a special mural in honor of one of the children killed in the Robb Elementary School shooting. Our producer, Evelyn Sandoval, brings us this powerful story on how art may help heal after tragedy.
My name is Tino Ortega and I'm an El Paso muralist. I grew up in the lower valley right there in El Paso, right there on Alameda and Zaragoza. I grew up right there by the Isleta Mission. I went to Isleta Elementary there. I would see the giant mural of the Virgen de Guadalupe and just being mesmerized by art and just being exposed to it at such an early age. And unfortunately, I grew up from a really poor family, so we wouldn't have like materials, or we wouldn't be able to afford paper and pencils. I remember like finding like the backs of photographs, like finding blank sheets and just drawing on the back of photographs because there was nothing else to draw on. When I paint, I don't think about anything else. Like, to me, painting is the easy thing. To me, it's just that escape. It's always been my escape. I didn't realize that, until I was talking to my therapist, but they're like, well, maybe you use your painting as an escape from reality. And it's like, you know what, I can definitely see that. I remember growing up and watching Bob Ross, and he would say things like, if there's something that you don't like about the painting, then don't be upset, because you can always just paint over it. You can always start again. Sometimes where, a painting's not going right and it's not exactly what I want it to be, and I'm just like, okay, just calm down, take your break, and then start over. Start again. You can do it. I wanted to become a full-time artist was because I was unfulfilled and I was just unhappy in a job that, it paid well, but it wasn't what I wanted to do. Doing art, it helps me with my mental health because it makes me forget about everything else. It makes me just, focus on the paint, and nothing else matters other than just the painting. I remember when I was doing the South Conchas mural, Candace out there at Desert Mama Boutique, she wanted to originally do a green balloon because green is the color for Mental Health Awareness Month, and she was talking to me about how she had lost her sister to a battle with mental health. That's where we came up with Don't Be South Conchas. That mural is about just paying attention to mental health and just it's like it's okay to ask for help sometimes. It's like you don't have to do things alone, and you will have sometimes more of a support system than you think sometimes. Like these murals, I don't even get paid for them. I ask for the cost of materials and a wall. Like, hey, make sure that the wall's not gonna get painted over. and just, cover the cost of materials. But, this project is about spreading that positivity and spreading that joy, leaving El Paso a better spot than how I found it. I remember, living out of El Paso and moving to Seattle and just experiencing the huge art scene that they had there and in Portland. My goals out of all of this are just let's see how big we can make this. Let's see how great we can make El Paso. That's why I thought it was really important to incorporate, who we are culturally. That's why, all these things that I put up on the wall, like they're messages of encouragement and of love and of admiration, and in no way trying to belittle anybody in any way. Like, it's always about positivity and just bringing that, connectivity to the community. To me, that's what's important, is to make sure that we feel represented on a wall, because representation matters. When you see words like chuco or ay or con huevos, con huevos was a mural that was meant about perseverance in the face of adversity. It's about, doing something courageously. It's about who we are. I know a lot of people that use that. With August 3rd, it was a little bit different, because we saw all these murals going up of El Paso Strong, and all these people just showing their support and love. We forget about certain things, and it's a way of keeping that remembrance and never forgetting, but at the same time bringing the community together.
In El Paso, Texas, today the investigation continued into yesterday's mass shooting.
When the August 3rd shooting happened, there's a lot of things that were happening in my own personal life as well. At the same time, I was also going through a divorce, and then right after that, we went through COVID. Mental health is really important to me because I suffer from it. I know a lot of people that suffer from it. Medication has helped, going through therapy has helped. I grew up in, I guess, like a really traditional Mexican household where we didn't talk about things like that. It's hard because you go through these bouts of depression, and just doing a mediocre task is like climbing a mountain sometimes.
In the elementary school massacre that left 21 people dead, including 19 children in Uvalde, Texas.
I got contacted by a nonprofit called Más Cultura. They had mentioned to me about this project that they were looking to do in Uvalde. So they called me up and they asked me if I'd be interested in the project, and I said yes. And then from there, they gave us pretty much synopsises of all the kids, reading all the stories, and just falling in love with Jayla because she reminded me so much of my daughter. And I just remember being so nervous on my way there, because it was really important that, that the parents see their kid in the mural. I was really nervous because of that. I just remember being mentally just drained. Visiting Robb Elementary and seeing the school and just being there and, interacting with the parents it was just really intense. I definitely want to challenge myself. I want to see how far I can go. It's never about competing with anybody other than yourself, and just making sure that you're doing the best job you can do. That to me are my goals, and those are my ambitions. It's just, let's see how big we can get. Let's see how more realistic we can make this. Definitely keeping that positive mentality and that positive vibe of, just connectivity and just, that sense of community. I definitely want to explore especially where we come from, because that's where these murals are about. It's about that reflection process, about that period in time where you're reflecting over a tragedy. So it's about where we come from. So it's about also incorporating, our history of who we are as a people, where we're at right now and where we're going to choose to place ourselves. So it's definitely, that reflective process of how far are we going to go? How far are we going to take this? How much better are we going to become? Let's push that envelope.
We now continue our program with a conversation on mental health. We've brought you plenty of reporting over the years about the challenges of recruiting and retaining qualified providers in the region. Our next guest, Dr. Stuart Kelter, spent a career as a clinical and prescribing psychologist working in our borderland area. During that time, he also worked as a school psychologist in Las Cruces Public Schools. Now retired, he continues to share his expertise and experience during in-depth conversations on a Las Cruces community radio program called Delving In with Stuart Kelter on KTAL LP, airing Sunday mornings at 9. Please welcome to the program, Dr. Stuart Kelter. Stuart, thanks for joining us.
Thank you for having me.
We've heard a lot about how art can make an impact on one's mental health, especially during the pandemic. How can art improve our mental well-being or make an impact?
Well, I think there's a couple of ways. I think it helps the individual to integrate their experience in a way that's meaningful. So the trauma becomes, in a sense, grist for the mill. I mean, it can become a very meaningful type of self-expression and self-integration. But then in addition to that, if it's the kind of art form that you're sharing with the community or even doing with the community, for instance, a group mural project, it also gives a way to connect with the community and give to the community in a way that helps them to heal maybe from a collective trauma or at least a shared trauma.
Now, what are some ways that someone may be able to implement an activity like that into their life if they wanted to take up painting or maybe if they wanted to take up gardening on a regular basis? Is there anything they can do to ensure that they stick to it?
Well, it probably helps to do it in a group context. So finding a gardening group or a painting group or a pottery group, and that way you're connecting with other people at the same time. And if you are doing something to express your trauma, you already have a support group sort of built in if it's a group that you've gotten to know.
Now you brought up trauma. I'd like to help our audience understand trauma in a way that it can be just starting off with a simple definition.
Yeah, that's actually, it's probably not as simple as it seems because, we have something called PTSD, and that was a diagnosis that was created after the Vietnam War as a way of helping veterans to deal with war-related trauma, which typically would be either being in or directly witnessing a life-threatening situation. And that has been extrapolated to PTSD, for instance, for childhood trauma, whether it's sexual trauma or physical abuse, which is an extension of that definition. But I personally think that the definition ought to be expanded to be a kind of trauma spectrum, that it doesn't necessarily have to be life-threatening. So if a child, for instance, is being neglected or is in repeated situations where they're scared of being abandoned, it's not necessarily directly life-threatening, but there's an implication of it being highly, highly upsetting, and it's something that violates trust. And I think when trauma lasts, it's because there is that violation of trust either in life itself or in one's parent or one's friend. I mean, the more it has to do with losing faith in someone or something, the more long-lasting it typically is.
So can that also be implemented in, say, like a system, perhaps like a kid is growing up taught to respect the teacher,
right,
but the teacher violates that trust? Could that be a traumatic experience?
Certainly, yeah, it is possible for a child to be traumatized by a teacher if a teacher is exceptionally harsh. Now, if the child comes from a very harsh home environment, maybe they won't behave unless the teacher is also likewise harsh, but the problem is that compounds the expectation in the child that I don't have to behave unless someone's harsh with me, and I don't trust them if they're too harsh. It becomes very complicated. The child is no longer motivated to please, but is instead motivated by fear. And that's what tends to compound itself because the fear-bound child is going to act out partly out of anxiety that, oh, I'm going to get mistreated if I act out. Well, it's the anxiety is too strong, so I may as well act out and see if it really happens and test the adult.
Working many years as a school psychologist, was there some common signs that you noticed to lead you to believe that a child may be experiencing trauma?
Well, again, I think it has to do with the lack of trust, not seeing the teacher as a benign figure. So the two most common ways it's expressed is by being an acting out kid and challenging the rules all the time and talking out in class and getting into trouble, or the opposite, being too passive and withdrawn and not being really available for education for that reason. And of course, it's more common for boys to be the acting out type and the girls to be more the withdrawn type. So the girls are more likely to be overlooked for that reason.
How do traumatized children learn?
Well, that's the problem. If the trauma is too strong, they don't. very easily. Or I should say, what they're learning is not what's expected in school. They're learning to pay attention to cues in an adult's demeanor, whether they're going to be threatening or not, or whether they're going to be about to do something erratic. So they may listen for noises out in the hallway, or they may look at the teacher's face constantly, but they don't have enough bandwidth, in a sense, to pay attention, let's say, to learning to read or do arithmetic. Because that's an extreme example, but that is kind of what happens.
You produced a program on trauma-sensitive schools, learning more about them. What are trauma-sensitive schools?
Yeah, so this was one of my radio interviews with an old friend who unfortunately passed away a couple of months after the interview, named Susan Cole. And she was an attorney before she became I think she was a social worker and an attorney and a child advocate, all of those things. And she started an initiative through Harvard Law School as well as the Massachusetts Children's Alliance to create curricula that would help to train teachers to be sensitive to traumatized children, to understand what the signs were, to understand what it means to support such a child, to not take the purely punitive approach, but also instead to give guidance and support, rather than just behave.
Now, schools like this is a kind of like a whole school approach to helping students learn?
Yeah, it would be a whole school in the sense that it's not just the teachers that would be trained, it would be the janitors and the principal and the cafeteria monitors, that everyone has to be on board in understanding that children from traumatized families need an extra layer of support. They need to be supported all the time, really, and to feel that they count and that they're visible and that they're loved.
Now, New Mexico has ranked poorly in child well-being over the years, and one of the things that has been brought up in these reports has been that so many communities face trauma. When we look at New Mexico and the history within the state, what are some things that people should consider when trauma is being discussed about affecting our communities? How does it do that?
Well, probably the number one factor that creates the conditions for trauma is poverty. And so it's no surprise New Mexico is one of the poorest states in the country that it would have a high rate of trauma. When the parents don't have enough financial wherewithal, that they're anxious about losing their housing or not being able to repair their car or medical bills, that leads to a kind of a breakdown in the parents' composure. It's easier to get angry and to lash out. And so that's part of what happens. There's a lack of stability altogether.
If someone experienced trauma at a young age, say as a child, but didn't have access to help or didn't address it over the years, how can that affect them later in life?
Well, and when you say not having access, then you also mean they weren't lucky enough to have a very supportive teacher, because it doesn't have to be therapy. It could be someone who's with them much of the time. I mean, a really, really supportive teacher is probably even better than therapy, because in elementary school they're with them for so many hours per week. So, the question is, what can the child do after they grow up? Well, there is therapy. There is, if you have the luck to be in a very supportive relationship with someone who's healthier than you are, and that would be very lucky, because often traumatized people are attracted to people from a similar level of trauma, and then that can compound itself. So there's a certain amount of luck, a certain amount of resilience involved. Children who've been able to connect with at least some adults, not necessarily even in their family, but a teacher or a coach or something like that, have a much better chance of getting through and actually healing from their trauma.
I'd like to move on and talk about bullying and peer culture. Do you feel that we as a society look at bullying differently now compared to perhaps when you started your career?
Only superficially. I think we have more bullying programs, but I don't think they're done in a very sophisticated way. And I think part of the problem is that we really expect the teachers to handle the bully, to punish the bully, maybe bring in the parents. But I think if you really want to combat bullying, it would have to be a much more comprehensive approach where the children themselves, even from a fairly young age, are taught how to identify bullying and how to stand up to bullying as a group, and not to basically creating a peer culture where it's not tolerated. I don't think the adults alone can do it. I think it has to be the whole community.
Now, peer culture obviously can lead to some negative problems if it's a negative environment. Is that correct? When you're talking about perhaps bullying and influence on young people, leading to perhaps unhealthy lifestyle habits?
In other words, the victim of the bullying.
Yeah, well, I mean, I'm talking about peer culture. Could it perhaps lead to, could it be both positive and negative?
I'm not sure that there'd be a positive to being bullied.
No, I mean with peer culture.
With peer culture.
In general, and
yeah,
how,
I mean, peer
how
culture
it works
is
and operates.
peer culture is a very powerful thing. It's not just related to bullying. It's also relating to sexuality, to violence, to caring about school or not. I mean, it's really a pervasive thing. And of course, once a child gets to adolescence, the peer culture is a stronger influence even than the family. Particularly on children or adolescents who are on the edge between being productive versus counterproductive.
I see. Now, you've also done some research into new approaches on mental health. We just have a little over a minute left, but I'd like to hear from you. What are some new approaches that may be effective when we're talking about mental health and addressing it?
Well, that's a very big topic. I think one of the approaches is to really take seriously the effect of stress on the next generation. So one of the interviews I did was with Isabelle Mansoui, who is a researcher in Geneva, Switzerland, about epigenetics, that it turns out that you don't just inherit your genes, you inherit the settings of the genes depending on how stressed out the parent was, not just the mother. So it's not just an in utero thing. If the male, and this is a mouse model, so it's not totally established yet, but if a male mouse is stressed out by, let's say, being put in a bucket of water and rescued after it's panicking, not a very nice experiment, but it turns out that even if that father mouse is separated from the offspring so that there's no environmental effect at that point, that offspring will have less resilience for stress than a mouse child of non-stressed parents. So the implication is that it's super important for parents to be getting support, especially prior to the pregnancy, during the pregnancy, but also for the father as well, to not be stressed. I mean, I think we're maybe just beginning to recognize all the factors that go into vulnerability.
Wow. Well, unfortunately, we're out of time, but I want to thank you so much, Dr. Stuart Kelter, for joining us.
Thank you for having me.
Moving on, we now learn more about a local organization in Alamogordo that was founded by a group of cancer survivors and their friends and family with a mission to provide support to patients by helping ease the stress they may be dealing with while promoting wellness and health education. Our producer, Christian Valle, shares their story on this segment of Community Connection.
CAPT is a primary cancer prevention and support center, and we also have a small center for integrative wellness. And CAPT stands for Cancer Awareness, Prevalence, Prevention, and Early Detection. Prior to 1994, my family had not been touched by cancer. At this point, we've had 17 family members diagnosed with cancer. We've lost 13 of them. So it suddenly came straight up in my face that this isn't a genetic predisposition. We've got environmental factors that are causing the cancer that we're experiencing today. Not only cancer, but all chronic illnesses. They're skyrocketing, and we've got to do something about it.
Well, I was in and out of foster care quite frequently and didn't exactly know, what was what most of the time between being switched towards schools and everything else. Nothing was consistent. It definitely wasn't what you would want a child to grow up in. As I got older, the anxiety got worse. Being here at CAPT and walking the labyrinth, I was able to start learning some healthier ways of coping with the anxiety and the stress. I was able to start reaching out. My anxiety has calmed down to the point where I am now going back to continue my bachelor's degree over at NMSU in Las Cruces. Going into school counseling, I'm hoping that, not only can we make a difference here, but this kind of stuff can be spread to our children and the next generations so that it just creates a better balanced, healthier way of life.
We also help them relax. We have an ionic foot bath center, zero gravity chair, and medical massage chair, and these are provided free of charge to anyone with a diagnosis of cancer. More than 51,000 cancer patients have been served at CAPT in the last 20 years. We're open from 10 to 5 Monday through Friday. CAPT.org, our website. We have Facebook page. And then we have the Trinity Turtle Healing Labyrinth Park Facebook page. So if we can reduce the stress of our population from the tiny child up to our senior citizens, our bodies have an opportunity to heal, and we're going to see a different future for wellness in our community. Our vision is a vision of health for the people of New Mexico and eventually the world. Join us. We need your help.
That's it for this week's episode. You can view past episodes of Fronteras A Changing America by subscribing to our KRWG News YouTube channel. And you can also stay updated with news anytime at our website, krwg.org. Thank you for joining us this week. I'm Anthony Moreno. We'll see you next time.